I'm going to ask Heather Frier. Is that, I'm bad with names, I apologize. Is that how you pronounce it? Frier. I got Heather right. Who is the social work supervisor to talk about the discharge planning process. As most of you know who work on the floors and the outpatient coordinators, our patients require quite a bit of support, and social work does a phenomenal job getting them out and taken care of in the home.
So I'm going to take a couple minutes to go over the discharge planning process for the transplant patient. Most of you here have worked with social work. You know what we do, but sometimes it's good to just go over it. So discharge planning starts on day 1 of admission, and in the transplant case, it actually starts when they come to the clinic. So we see the patients when they're in the clinic. I know Susan already spoke with you, and she went over what her role is. And so it starts day 1 and a little bit before in the clinic. The transplant social worker rounds daily with the teams to ensure timely, safe discharge planning for all admitted patients. The social worker also participates in multidisciplinary rounds on Thursdays and is quite an integral part of the discharge planning process and the team. So discharge planning includes, but is not limited to, the following. Home care referrals, also known as a CHA, which stands for a Certified Home Health Agency, for nursing, physical therapy, and home health aid services. A major component is the visiting nurse who provides medical education and compliance around the medications, which are a very important part of the patient's recovery. Reinstating home attendant or personal care worker services prior to discharge home. A lot of our patients here have prior services, so that's very important. Ordering of durable medical equipment as recommended by the rehab service. Facilitating discharges to a subacute rehab if indicated. Setting up return to dialysis if a transplant fails or is temporarily needed. Referrals to outside community agencies, which some examples are Accessoride, elder law services, Medicaid, whether it be applying for community Medicaid, pooled income trust funds, spend down programs, referrals to food banks, referrals for domestic violence, elder abuse, safe houses, shelter placement, substance abuse, hospice, palliative care, IV infusion, and the list goes on, but these are some of the things that the social worker would be involved in. The transplant social worker is clinically trained to ensure that the patient and or family receives appropriate emotional support, appropriate coping mechanisms, guidance in understanding their role in post-transplant care, cognitively as well as concretely, and referrals to outpatient counseling if indicated. Okay, that's a very brief overview of what we do on the floors. There's a lot I haven't covered, but if you have any questions or concerns, feel free to ask. Okay.
Thank you.
All right, thank you.